So welcome everybody. This is our session really ahead of to support applying or thinking about applying to the Predoctoral Award, so the NIHR Predoctoral Award. And just to say to begin with that the language of this has changed really from the 29th of January when the NIHR opened this funding award. And all that they've done is that they have simplified all of their pre-doctoral fellowships. So before we had a PCAF, the pre-doctoral clinical academic fellowship. We had a one for people in local authorities, another one for methodologists. And basically what they have done is that they've simplified it, that it's got one name, and that these awards, they've then got separate funding panels who will review whether if you are applying as a clinical or practitioner academic, or if you're applying from a local authority, or if you're a methodologist. So that's why the language has changed, but the awards that they offer are the same. They've just simplified their application and review process. So I should just quickly introduce myself. So I'm Catherine Evans. I am a Deputy Director of the King's Clinical Academic Training Office. I'm a clinical academic in palliative care and nursing based at King's College London. So welcome everybody. Can we go to the next slide? So what we're going to cover today, I've been joined with colleagues who are going to introduce themselves before they speak. And we've also been joined by two previous award holders as well of what was then the PCAF. And they'll be talking about their experiences. So our intention today really is to encourage you to look to apply for one of these pre-doctoral awards. The support and opportunities available for you at King's College London, and also to help you in your confidence in feeling able to apply for one of these awards. So I'm going to give a very brief overview of the King's Clinical Academic Training Office, so you know who we are and what we offer. And then where this pre-doctoral award fits within the pipeline really in pursuing research within your careers. And then we're going to have some of the key elements of a successful application from Emma. And then understanding more about the research and training support available for you at King's for this particular funding scheme. And two previous award holders. And then finally, we've then got some time for question and answers. So we've realised that our Q&A function is not working. So we're going to ask you to please pop questions in the chat. Please do that. There's things particularly that you want to make sure that we cover in this webinar. We will attempt to answer those questions in the Q&A. If there's things that we don't have an opportunity to answer, or we're not sure what the answer is and we need to go and check that, we will do that and follow up with you via email. So please, I can see Joe is busy posting. So please do also put your questions in the chat as we move through. So next slide. So first of all, just a brief introduction as to what is the King's Clinical Academic Training Office, called CATO for short. So our mission is very much to facilitate and support individuals pursuing a clinical academic career in King's College London and with particularly our NHS partners. And what's key about this is very much about enabling all health and care professionals across disciplines, across their different stages of career, and very much in supporting people to realise their full potential in pursuing research within their respective careers. And really in nurturing those future research leaders, those future clinical academic leaders, and those future individuals leading within clinical practice and education as well. Next slide, please. And what this slide details is just what CATO is about. So this is taken from our strategy. And what you can see on this slide is our 4 key strategic priorities. And underneath that are cross-cutting themes. So Cato's purpose is very much about championing clinical academic careers. So doing this sort of webinar. And we do that through capacity building, so supporting people to pursue fellowships, demystifying and inspiring them to pursue a fellowship to support them with their research training. We also deliver our own bespoke career development training as well. So things like writing for publication, writing fellowship applications. And maybe most importantly is to act as a central visible contact point. Because one of the things that we frequently hear from our clinical and practitioner colleagues is that often they find it very difficult to navigate, to find the support that they need to be able to pursue research within their careers. Next slide, please. And an example of our commitment, particularly to that research capacity building piece, is the number and the diversity of individuals who are studying with us at PhD level, so PGRs, postgraduate research. And so these are the PGRs that we're currently registered with us at King's College London. And what's probably most striking about this is the diversity across the different health faculties. So we have 4 health faculties at King's College London, and you can see them on here. So in dentistry, life sciences and medicine, nursing, midwifery and palliative care, psychiatry and psychology. And we also have our faculty for social policy and practice as well, who are well positioned to support individuals from local authorities, for example. And then what you can see on the right hand side is then the diversity of disciplines who are undertaking doctoral study with us. So nurses, midwives, psychologists, AHPs, pharmacists. And the purpose really of showing you this is just to, again, to inspire you as to the diversity and inclusivity of individuals who are studying with us and the phenomenal offer that we're able to provide across our faculties within the university. Next slide, please. Oh, and Maya, I can see you've said that the slides are not moving. Are they moving for you now? Is it all right for everybody else? Okay, brilliant. Thank you. So what we wanted to discuss was I just wanted to share with you where the NIHR pre-doctoral award sits. So if we can just click again, Nora, I'm just going to highlight that. Oh no, go back one. Sorry, it's not worked. Just go back one. Thank you. There it is. Brilliant. So the NIHR pre-doctoral award on this pipeline is sitting there, sort of towards the left-hand side. And I think what we particularly wanted to emphasise is that this is part of an ongoing training programme that is available. So for many individuals, their exposure to research might have been through something like a research residency or a research internship. And those are the sorts of things that are offered through the NIHR to give research exposure. So that's both through national funding schemes and also through local things. So KCH is King's College Hospital and GSTT is Guy's and St Thomas's Hospital. And they both have their own respective research internship schemes. So in applying for pre-doctoral awards, it really helps people if they've had some exposure to research that is clearly that they're able to argue in detail why it is that they feel that the NIHR should invest in them at this point in time. But what's also important is that transition from a pre-doctoral as to, well, what happens next in terms of then transitioning to securing doctoral funding. So a lot of what we're talking about is those points of transition. What positions you well to be able to compete for a pre-doctoral award? And what do you need to be detailing in that application that is demonstrating that you're going to be well positioned to then transition for doctoral funding? And then the rest of the pipeline is just detailing the opportunities beyond doctoral to being an independent researcher. And then underneath that blue bar at the bottom also details all the infrastructure and support that is available. So all this information is available on the NIHR website. We will pop in the chat sort of connections to their various web pages. They have fantastic web pages on career development in research for nurses and midwives, for professions allied to healthcare, which also walks you through this pipeline of opportunities. Next slide, please. And now I'm going to hand over to Emma. So Emma, if you'd like to unmute and put your camera on and introduce yourself.
Thank you very much. Yes, so I'm Dr. Emma Godfrey. I'm a reader in health psychology, and I've also been on the PCAF panel for the last couple of years. So I've been screening these applications. And what I'm going to do is just give you a bit of an overview of what makes a good application. Everything is changing quite rapidly, so I really recommend that you do look at the NIHR website and really check out the latest guidance, because they do change things, even the terminology that they use. So it's really important that you kind of use the best, most up-to-date information that you can. Next slide, please. So when you are scoring the applications, then they're scored from 1 to 10 on each of the criteria that I'm going to talk about, where 10 is excellent, so all the criteria are met and there are no weaknesses, and 7 to 9 is very good, all criteria met with minor weaknesses. Mostly you need to score in that sort of 7 to 10 range really to be competitive. You could maybe fall down a little bit on one of the areas, but I think you know, mostly you need to be trying to score on that top 7 to 10 range to be competitive. Next slide, please. So what we're looking for when we're scoring these is the suitability of the applicant is one of the most important things. So are you suitable for a career as a clinical academic, and have you shown that that is something that you've been interested in by the sorts of work you've been doing? Maybe you've done some research in your post already, or you've done one of these internships or something that demonstrates an interest in a research career. Then the appropriateness of the award to the experience and the trajectory of the applicant. So basically, are you at the right stage for this predoctoral fellowship? And then your commitment to a career as a clinical academic. So again, can we see a sort of pipeline through from the PCAF towards a doctoral application? So next slide, please. Yeah, I think that it is the same data. So this just gives you an example of the kind of thing that might be written when we're scoring these applications. And as I said, you try to aim to score for excellent or very good if you possibly can. So here's an example. The applicant is a senior nurse within a sort of trust who's got relevant research experience gained via NIHR internship. Wants to prepare for a PhD in a field that she's already working in, identified a research gap, sees the PCAF as a way of conducting some preliminary research via MRes to prepare for the PhD application. So again, getting the formal training there is very important, okay, because that will show that you were then ready to apply for a PhD. And then obviously if you've got previous, you know, good scores on other courses that you might have done, for example, your undergraduate course, then that will obviously be a plus. And also that we can see, as I said, that this is going to lead to a strong doctoral application in the future. We're not going to look at that actual doctoral application at this point, but just that we can see the pipeline there. Next slide, please. So next, so apart from scoring the applicant, we're going to score the training and development plan, and that's about the quality and appropriateness of the academic training. So you need there to describe how your training plan has been developed, and whether the training is necessary and sufficient to give you a competitive doctoral application. So clear plans to develop the doctoral proposal, but not the actual proposal itself. And you are also allowed to use up to 20% of your time for professional development. So again, if that's something that you want to do, and how you're going to use that would be very useful to explain in your application. Next slide, please. So here's an example. The applicant's training and development plan was developed using the VTI Researcher Development Framework. Now that's really useful because it gives you clear categories where you can put your training and development, so you can really make it very clear exactly what you're planning to do and how it's going to help you develop. Appropriate courses are identified. So, for example, the MRes is obviously one that we offer here at King's and could be very appropriate, and that's something that they'll be looking for. But it may be that there's another specialised MSc course that is also very appropriate for you. So again, that could be something you could put down there. PPIE training is included. It's not called that anymore. I think they've just changed it and it's now called People and Communities or something. So again, really make sure that you get the language right here, and look at the latest guidance so you are using that. But that's about really training to be able to include the right participants in the development of your ideas. So patients and the public, if appropriate, and maybe some stakeholders as well. So that whole area needs to include some training. They don't really expect you to have done that at this point, but obviously to have a plan to do that in the future to make sure your doctoral application is really strong. And then a clear plan to submit a doctoral application. So really saying that that's your aim and making that very clear in your application. Next slide, please. The other thing that will be scored is the sites and supervision, and that's really about a strong academic environment to support you with your development. So the proposed academic supervision, we want to see people that have a track record of supervising clinical academics, if possible, and certainly PhD students. And the appropriateness of the proposed clinical academic career mentor, that's very important as well. So have you got someone in your own profession that can be a mentor for you and support your development as a clinical academic? And then arrangements for ensuring protected time to undertake the academic training proposed and continue clinical service alongside that. So that's really important again, so that the protected time you have to complete your PCAF is very clear in your application, and that that's been thought through with your academic supervisors. And a demonstrable track record of the host academic higher education institute in training clinicians who've gone on to develop academic careers. And obviously here at King's, we do have that in spades, as you saw from the previous slides. So we're in a very strong position to offer that, but other institutions may also be able to do that. Next slide, please. And then finance. Does the application represent value for money? And are the training and development costs within budget? So again, I don't know what the latest is about the amount of money for this award and the training and development budgets, but make sure that that is clearly identified in your application and that you are, within the budget guidelines. For example, there are set budgets for how much can go for training, how much can go for, going on courses and going to conferences and so on. So really make sure that that's very clear within your application and that it's very clear why you need that support. Next slide, please. And then the overall recommendation, after we've looked at all those areas, the total maximum score is 30. And you need to be in the top 30 applications to be funded. So you want to try and score as highly as you can on all of those areas in order to get into that top band, because it's the top band comparing all the applicants together. And each applicant is scored by 2 to 3 reviewers. So each applicant will get a chance to have 2 to 3 reviewers of their application. Next slide, please. So overall, a strong candidate will have some publications may be relevant to the topic area. You don't have to be a first author, but maybe on someone else's publications, that you have used PPI or want to use PPI. So that's very clearly identified in your application. You've identified your training needs using that VTI researcher development framework, which gives you very clear categories to describe your training needs. That you're going to do some leadership training is also very helpful, because obviously we want you to think about that as a future for you as a leading clinical academic in the future. So some leadership training would be very helpful in there. And that your PCAF will include some outputs. So you're planning to get something out of this other than just a doctoral application, but maybe some other outputs as well that would be helpful for your career. So that's, I think, all the slides that I have. I will be staying to, answer any questions if there are any questions that I can help with at the end. But thank you for listening, and I hope that's been helpful.
Thank you, Emma. That was fantastic. I think it's just so illuminating for people to hear top tips and your reflections as a member of the funding panel who has been reviewing many of these applications. So thank you very much. That was hugely helpful. I'm now going to hand over to Maria. Maria, if you'd like to pop your camera on and unmute and introduce yourself.
Thank you, Catherine. Good afternoon, everyone. My name is Maria Duaso. I'm a senior lecturer in the Faculty of Nursing, Midwifery and Palliative Care, where I lead the MSc Clinical Research Delivery and co-lead the Masters in Clinical Research. And I'm here to talk to you about what King's can offer in terms of training and support with your predoctoral award application. Nora, if we could go to the next slide, please. Thank you. So we have heard how the Predoctoral Award has changed in name and is now called an overall Predoctoral Award, but we still have two separate ways to apply to it. You could do the full award. The standard one would be an equivalent of 12 months, and if it's full time, and would cover all your salary costs and included clinical time up to 20%. And you can include a full master's fee. So that is something that has changed with previous applications. So if can be justified, if you don't have a master's, I saw some questions in the chat, can you apply? So most, depending where you would like to do your PhD, but most higher academic institutions would require you to have a master's in order to be applying for a PhD. So if it's necessary, if you don't have that research expertise, if doing a master's is going to help you perhaps to add a publication that you didn't have there before. So if it's justifiable, the funding could cover your full master's fee, but you need to justify that. Otherwise, you can use up to £5,000 to bespoke training and education courses that can include master level training. There's also funding to attend conferences, to present your work at conferences and any associated cost. We've heard how important is that your research proposal and your work is informed by the opinions of people and communities, what we called previously PPIE. So you've got money as well towards that. So if you haven't done already, if you haven't discussed your ideas, you can use that money to meet with people who are experiencing the area of research that you're interested in, and they can inform your application. And also there's a little bit of money towards your supervisor's fees as well. So this would be the standard full award. But if you feel that you're already ready to apply for a PhD because you've already got a master's or the right training, and it's more about having that time and that space you need to concentrate on writing a fellowship application for a doctoral, then you can apply for a predoctoral bridge. And it's protected time to develop this application, for example, 6 months. And there's also money, but it may be pro rata, that covers your salary costs. So it will be less time. So the equivalent of the salary cost and some money to work with PPI, also attend conferences if needed or some formal courses. But again, very much tailored to what is your proposal and what you're planning to do. So these are the two main ways to apply. Sorry, Nora, if you could go to the next slide, please. Has it moved? Sorry, I might have done something different. Are we in the training slide? Yeah.
Yeah, that's right.
Good. Thank you. Apologies. I was trying to move myself. So we've mentioned things that you can include in the training already, and you can include full master's courses if appropriate, but also, short courses or any other training or specialist training that you feel is going to make your application better. And you can also spend time with other research groups or centers. So you could do that. We've mentioned leadership training, working with people, PPI work. If your CV, if you think about to be competitive, I need to have some publications, you could use that time as well to present at a conference, to write up your dissertation, or even do a top-up dissertation. If you haven't done your full master's, you've got a PhD, but you haven't done a dissertation, you could use your time to do that, or you could do just even preliminary research that will support your subsequent doctoral proposal. But be mindful that research costs per se are not included and cannot be included in the application. So this is the range of things you might want to consider in your training. If we can move next, please, Nora.
Yep, we're there.
Okay, sorry, it's not moving for me, so if you can confirm, thank you. So examples of masters that you can apply and that are available at King's that have been popular and used by other pre-doctoral applicants in the past are the advanced quantitative research methods and advanced qualitative research methods. And I would like to highlight the module that we created specifically when the PCAF award was created, which is a PhD funding proposal development in healthcare research. One of the main outputs of your pre-doctoral award is to write this doctoral application. And it can be quite a lonely process. You might be in different institutions and not surrounded by people who are going through this journey. And we've seen, having run this module for 5 years, where people locally in London, but also because it's a hybrid module around the country, people are joining us online, how helpful it is to get together with other people who are going through this process and writing these proposals together, learning from each other, and with the academic support from expert researchers at King's. So that is an option that you could consider. We've also created a module on co-producing and co-designing healthcare social care interventions. If you think your PhD might include intervention development, co-design, again, this is examples of modules that you could look at. And here is the link as well that you can explore further for what other short courses are available in King's. If we could go next, please. Okay, I can see in the chat some people are mentioning King's College London Skills Forge skills. So if you are a student at King's, and particularly if you are doing a program, you also have, in addition, a lot of additional courses and that are available to you that you can use mapping in the Vitae tool that Emma mentioned before to add training that you could use. If you plan to do perhaps a full master's, something that you could consider is the Embracing Clinical Research that includes advanced quantitative and advanced qualitative research methods. And you can do an optional module in any of the health faculties that could fit your research interest, or you could add this PhD proposal module as an optional module. And Nora, if you click again, I think it will mention the PG Cert. Please. So the PG Cert is an option as well that you can, if you don't want to do the full master's, you've got a master's, but you think, okay, I want to do some master's level training in research that fits within the budget, that is £5,000, you could do a PG Cert, 60 credits, doing either both advanced qualitative and quantitative research methods, or swap one of them for the PhD proposal module. Again, this is something that we've designed with pre-doctoral applicants in mind, because we think is a package that will support them through the journey in preparing a competitive funding PhD proposal. If we can go next, please. We've mentioned how you need, as part of your application, to put a support team that will include at least one primary academic supervisor and a mentor. And when you're looking for mentors, you probably, or supervisors, you're thinking, okay, they have to have the research expertise in my area of research. But Emma has also mentioned how it's important that you can demonstrate that they have the ability and the time to supervise you, and also that there is a record of conversion and supporting master's students to PhD. Here I've put a link of our Pew portal at King's, where you can identify different research groups and potential academics that could support in your application. If we go next, please, Nora. And then at King's, you will be able to, you will also need to have a host organization support statement. So whether you are going to, your main host is going to be your trust or where you work, or you're going to move to a higher education institution, both host and partner organizations will have to write a joint statement that say how they're going to support you. So it has to be tailored to you and include details about how the support is going to be ongoing after when you've completed the award, and detail the experience they have already in supporting this type of applications. As we've mentioned, King's is in a very good position to support allied healthcare professionals in dentistry and nursing and pharmacy to do predoctoral research and to move into doctoral studies. We've seen the range and breadth of PhD students we have, and now I'm just going to put several slides where you can find information of the different faculties that can host and that can provide supervisory support at King's, and you can explore them further at your leisure, because I'm just conscious of the time and we want to hear from our PCAF awardees. But Nora, if you could just move forward. So we've got the Faculty of Nursing, Midwifery and Palliative Care, as well as the Faculty of Life Science and Medicine, with their different schools that also have a ranked very highly and experience of supervising many doctoral students. And if we move next, please, Nora. You can also have contacts at the Institute of Psychiatry, Psychology and Neuroscience, where another World Center leading in research and education within this field. And here is a list of who to contact in the different organizations. So I hope this is helpful and has given you a good overview of the support and the training that is available here at King's. And we'll I'm going to pass on to Ellie, I think, yes, next, to hear from the real experience of someone who has applied for what was the PCAF award, has done some training with us, and can explain her experience and give you best tips. Thank you very much.
Hi, everybody. One of the errors I've made with this is that I've made too many slides for a very short amount of time, so I'm gonna whiz through it. But rule number one, when you're preparing some applications and doing presentations and research. But nice to meet you all. My name's Ellie Corcoran, and I'm an ICU nurse and research nurse by background. And it was through my research nursing that I started developing an interest in ultrasound and in interprofessional ultrasound. So I, with a consultant in research, developed a research project that we wanted to sort of take forward beyond PhD level, and do sort of lots of stages to the research project along the way that we thought would really fit nicely with a PCAF and then also a DCAF, along with me developing my academic and clinical experience along the way. So with the development of this concept, this study, I learnt ultrasound scanning of the heart and of the lungs and the abdomen and blood vessels. And then I also was lucky enough to secure some funding to go to Sydney in Australia for a couple of months to learn advanced echo. And that was all before I applied for the PCAF. So during the time that I was working full-time as a research nurse, I developed a PCAF application with this ICU and research consultant, and then alongside an academic supervisor that I'd scoped out and found before I started the application. So next slide, please. So I just thought I'd show a little bit about the study that I'm doing. So we basically developed a specific scan we use in ICU, and we teach it to nurses, ACCPs, physiotherapists and doctors, and it's a super simple whole body or multi-system ultrasound scan, and we're developing and refining a training program to teach all of these professions, and then we're moving on to seeing how easily implementable the scan is as part of routine ICU care. Eventually, beyond the PhD, we'll be looking at how it impacts patient outcomes, but that's a bit further into the future. Next slide, please. So I've talked a bit about what I want to do in the future. The PhD that I'm doing now is this refining of the training program, developing some acceptability work, looking at staff acceptability of the scan, and then we'll do a feasibility RCT. But in order to get to that, we had to develop the design of the scan and the concept of the study and start to sort of work out the teething problems. And this is what we wanted to do in the PCAF. So there was a lot of sort of planning and meetings with my supervisor, and then with Phil Hopkins, my consultant, that thought of this concept. Yeah, and that's basically how we came about to then applying for the PCAF. And I hadn't done my master's at this stage either, so I wanted to use that opportunity to do my master's. So going into the application then, so next slide, if that's okay. I think what was important to maybe talk to you guys about is what I included in my application. And I think I did this 5 years ago now, so 2020, and I understand that the application form has changed quite considerably this year, because I've got a couple of colleagues that are applying this year. And hopefully it should be fairly self-explanatory. Hopefully the guidelines are nice and detailed to give you enough guidance. But and I'm not sure whether you guys have spoken about this in the last hour, but the thing that was really hammered home to me was the 3 Ps. So the person, the project, and the place. So what they really want you to really focus on is what your strengths are about yourself, what your strengths are about your research projects. You may not have a completely sort of formed idea in your mind yet, but to show that you have interest in it and that you've thought about it and it's something that you want to develop, and you can see that it will make an impact, but also that you can develop on in the future and use it, I think, as part of your clinical academic and career in the future too. And then the place, that it's a place that is going to really sort of support you. But you also need to be thinking about what your weaknesses are in these areas too. And that's what the application really wants to see, is if you haven't got these strengths, what things you can do to support you. And that's what the PCAF is all about, is basically supporting your training, your learning, and then how to progress and strengthen you in all of these 3 Ps to make you the best sort of clinical academic that you can be in the future. So for the person, so can you demonstrate a commitment to your area of interest? So I wrote about undertaking a placement in nurse-led ultrasound to advance my sonography skills. I'd gained additional funding to present an abstract at a conference and attend an ultrasound course, because I lacked some experience in publications at that stage. And I published that abstract. And then I also carried out some exploratory PPI work, which I did through my hospital to understand issues around my research concept. And it's okay to talk about things that you've lined up rather than things that you've necessarily done. So if you're planning to do things, I think that's also acceptable. And please correct me if I'm wrong, if that's changed, but that's what I did in my application and they seem to be happy with it. And then also, how can you demonstrate your ambitions to continue research and become a clinical academic leader? So I discussed where I saw this PCAF taking me, and I had a firm plan for pursuing the funding for the DCAF, and to then hopefully lead in the future some interprofessional POCUS training, so ultrasound training and research postdoc. Next slide, please. And then with the project, so can you demonstrate a commitment to your area of interest? So I wrote about undertaking placement in nurse-led ultrasound. And then, sorry, Sorry. So do you have an idea in mind? So this doesn't need to be a fully formed idea yet, but you just need to show that you've got that commitment and genuine interest. I plan to conduct the first training program for my PCAF to work out any teething issues and design with the design and provide a head start to my PhD research. I wanted to scope out existing evidence, and then also I spoke to colleagues, lecturers that specialise in my research for advice and to scout out for possible supervision and mentorship, and then identified potential courses that could help progress the understanding of research methods and processes in academia. And then the other thing is that I started connecting with relevant organizations. So for me, I needed backing for radiology, but it might be for you like technology companies or other hospital departments or charities related to your specialist area. And then I think the most important thing for me was just choosing a topic that you enjoy. So you'll be writing about this research for years to come, and it's really important that you really believe in your area of work and that your passion will then shine through in your writing, and when you're being interviewed and when you're presenting to other people and teaching other people about your work. And then with regards to the place, if you could go on to the next slide. So does your place of work already have a good reputation in research conduct? So if not, what can you do to prove your department will be receptive to your research? So could you get consultants and managers on board early, involve them in the design process and talk to your local R&D department and so on? And do your supervisors and mentors, do they have sufficient experience in your area of specialty and research methods? And again, really importantly, do you get on? So it's really important to have a good relationship, and because you'll be working with them, not just, well, if you're planning to go on and do a PhD with this, then you'll be working with them for a long time to come. So it's making sure that you have that sort of good starting relationship with them too. I have gone on the next slide just to talk about things that you could look into for bolstering your experience, or what you could do to improve that. But I think you've already covered that in a previous slide. So I just thought, and this is something, if you've got the slides to take away in the next slide after this, just things that you could focus on now, just to try and remove the stress of doing an application. And it's just really to get things going as early as possible, and especially with those departments that have to be involved and do sign off and things like that. So I think finance is a really important element of that, and then your research R&D department, if you need to get the head of research to sign off, and obviously your host institution statements of supports and things like that, because it's coming to the end of the financial year. People will be stressed with deadlines, and obviously the people that you're asking to support you are going to be super busy. So just getting people aware and made aware early to get involved. And I think I've gone way over my time, so I'm going to stop talking now.
Oh, thank you, Ellie. Really, really helpful and very useful, I think, in seeing, what your pre-doctoral intention was and how that's gone on to then informed your successful doctoral funding and study. So very much that understanding for people that the pre-doctoral award sits very much in what have you been doing and what do you want to do afterwards. So very helpful that you demonstrated that. Thank you. Okay, so I'm now going to bring in Maya. Maya, can I welcome? I think we've got about 5 minutes, if that's possible. So if we could give us your highlights and top tips, that would be wonderful. Thank you.
Okay, so I haven't got anything prepared, I'm afraid, apart from one slide, which we'll come to in a minute. So I suppose I can't top that at all. Ellie's covered everything beautifully. What I could do is give you my perspective, so my experience, really. So I've been a clinician for a number of years. I don't want to say how many. So I came at this quite later on in my career, and I think that's important to say because, it is possible to do this when you've had a long clinical career as well. I didn't really think about research, honestly, for many years. And then I did my master's as part of my career progression in advanced nursing practice. I'm a diabetes nurse by trade. So I did that, because I want to get my band 7. And then I thought, actually, I'm really quite enjoying this academic world. And I published my master's. So I got a first publication, and then I got involved in a bit more research, and it's kind of snowballed from then. And then I kind of made that decision that I actually want to take this a bit further. So I was doing a bit of teaching at King's at that point as well, and I was very lucky to be in that environment. So I was exposed to a research team, and I learned a lot about different research methods. So I had that advantage. So I applied for the PCAF. And what I would say is time. Everything takes quite a lot of time. To get a good application together takes time, and then you've got to wait for the application portals to open, then you've got to wait for your interviews, and then you've got to wait again before you start. So this is a long-term commitment, and you've really got to want it, and you've got to enjoy doing it, because you're going to be doing it, as Ellie said, for a long time, and hopefully this is the start of a long clinical academic career for you. So won't go through my PCAF, what I did to apply for it, but I'll tell you what I did during it. So I planned a lot of training. I did a lot of that training. The leadership training was really good. What I did do is I thought I was going to publish a systematic review. That didn't happen. So also be prepared to be flexible. What I did do is I collected some preliminary data around the topic that I'm interested in, and I was lucky enough to get that accepted at a European conference. So I presented at the European Association for the Study of Diabetes. Thank you very much. That's that slide. And we also went to a couple more conferences funded by the NIHR, which is amazing for networking and for learning. If you look on the next slide, thank you. That's my poster. So the motivation for my PCAF was not, it didn't come from anywhere else. It was my own experiences of my clinical practice. So I was working in Lambeth in South London, you know, an area of very high social deprivation and mixed ethnicity. And I work with people with type 2 diabetes. And I see people getting younger all the time in my clinic. And my clinic that I work in and I help to set up, we cater for people with early onset kidney disease, so early kidney problems in diabetes. And the people are getting younger and younger. And I'm thinking there's a problem here. There's a research gap here that hasn't been filled. And I think that's really important as well, because the NIHR are looking for originality, and they're looking for something that's yours, that you're passionate about, that you found. If you've got supervisors who are also interested in that world and that have experience, that's good too. And luckily my supervisors do. So this was just an observational study, just some preliminary data that I collected. And I found out that half of my cohort who were attending my clinic had early stage kidney disease, who were under 45 years old. Half of them. That was incredible. It was associated with mental health problems. It was associated with smoking as well. And actually, when we looked at the kind of cardiorenal protective medications we're supposed to be using in this group, we weren't using them very well. So that gave me some really good information, a good rationale, if you like, to add to my PhD application. So in my PhD, the plan is that I'm going to replicate this on a larger scale. And I'm going to be talking to the people in this group as well and working with them in a co-design methodology to come up with a mixed methods project, come up with some tangible, impactful solutions. What I would say as well, you need resilience, okay? Because I put my application in and I got to interview and everyone was like, well done, you've got to interview to get to that stage. It's really difficult. I had the interview went great. I didn't get it. So you need to be prepared for a little bit of disappointment. Only 50%, well, 50% is still quite a good mark, but actually in London last year, I think the pass rate for PhD at interview was 20%. So you go in it, but then if you're going to be having a career in clinical academia, you need to be able to accept this, because you'll be going for grants and they'll be rejected until you find the right funder, and you know that is the kind of the life. So I've not given up. I'm dusting myself off and I'm going to have another go this year. So I think that's me. Good luck. Good luck with your applications. I think it's definitely the career I should have probably chosen a long time ago. So if you're a bit younger than me and you're getting into it now, I think that's great. Thank you.
Thank you, Maya. I think that's fantastic and great messages, isn't it? That yes, you can pursue this when you've already had a clinical career, but your insight is actually pursue it earlier in your clinical career, which there is many more opportunities for people to do that. So very quickly, I just wanted to share this slide with you. So this is just taken from the NIHR website. Their Predoctoral Award funding opened on the 29th of January, closes 20th of March. But the key thing on this slide is that they're holding a webinar on the 10th of February. So if you're looking to apply for one of these awards, I would definitely register and attend that webinar, because again, it's opportunity for you to ask questions. You get more sort of top tips on what they're looking for. So I would absolutely encourage you to register for that. Next slide. And I'm also just wanted to take the opportunity. I mentioned the NIHR Insight programme, not Ellie's PhD. This is another use of the word insight. So this is another funding programme from the NIHR targeted at the nurses, midwives and professions allied to healthcare. We're currently open at the moment, offering scholarships for research master's programmes. So those scholarship funding is open now. That closes at the end of April. Do just blip our QR code if this is something that you're interested in, and that will take you directly to the website. This funding, though, is aimed at people earlier in their research career. So you have to be within 5 years of registration for your respective discipline. So the PCAF is much broader in terms of career stage. Insight is specifically targeted at people earlier in their research career. So do have a look at that if that's something you're interested in. Next slide. And then just to say now, we've probably got 5 minutes for questions. This is just our contact details as well for us at Cato and for Insight. Next slide. And then finally, this is just how you can connect with us at Cato through our website. We have our hub, which is our central resource point. So please do blip these QR codes. We'll share the slides with you as a way of connecting with us. So I'm going to stop there, and I think we'll stop sharing. And then we've got a few questions. Sam, I don't know if you want to come in and just pick some of those up. We've only got 4 minutes.
Yes, I'm conscious we've got a very short space of time. So hi, everyone. I'm Sam Irving. I'm an Associate Director at King's, responsible for professions allied to healthcare, working with Catherine. We've been answering a few in the chat if we've been going, but there are a couple if some of our wonderful speakers are still with us that might be able to take up. So Maria, we did have a question about someone who'd previously done your quantitative and qualitative modules, but was asking if there's any sort of refresher training you know of or would recommend.
Thank you. I think the important thing is, again, justify and tailor. So why do you need, a refresher, or is there another, are you planning for your PhD to do a particular methodology? So would you need to go more in depth in one of those methods? So there are lots of research methods, courses at King's, and you're welcome to look at the link we've provided in the presentation to explore further. But really, if you've already done them, they're going to be wondering what is that you need in addition now at this point of time to make you more competitive to apply and put together a proposal.
Brilliant. Thank you very much. If Emma's still with us, I think we've actually covered a bit of this, but it does come up a lot. Someone asking if the fact they've got no publications would be a huge problem. So I don't know if Emma's still on, if she wishes to come in on that. We have discussed it a bit, but just to get her experience.
Yeah, I mean, I don't think it's absolutely essential that you have publications, but obviously some kind of outputs would be really helpful. So that could be a conference that you've been to where you've had a poster like we saw before. But something that shows this commitment to research and to a research career. So obviously publications are great. So if you can get them, that would be fantastic. And if you do an MSc, you can normally get some kind of publication out of that with your supervisor. So that would be what I'd recommend. But, conference presentations are also things that you can evidence, so those kinds of things. So obviously the more you have, the better, but I don't think it's absolutely essential that you have a publication, but it's better if you can have something like that.
Yes, that's certainly the training I've heard from them before, that it's very much about, did you do a nice audit and do a poster of it and that kind of thing, and, showing that you were interested. We did have a hand briefly there for someone who possibly can't access the chat. Was it Lauren?
Sorry, yeah, that was me, but my question has just been answered. Thank you.
Marvelous. Thank you very much. Lots of us have popped lots of interesting sort of links in the chat as well. We have had a couple of more specific questions about things like the ODA and the Masters funding. So I wonder if they might be better taken offline, if you agree, Catherine, and we'll keep those in the chat. So we are not ignoring you. We will get back to you, but I think they're probably a bit specific for the general chat. I think mostly, unless there's any additional hands, that is probably all the questions we've had, which is fantastic. Again, I would say please do join the webinar on Monday that the NHR are doing. I will definitely be on it too, in the hope that they will answer some of my questions, because it does look a bit different this year. But they have reassured us that there is definitely still that ring fence funding that was for healthcare professions. So even if it looks different, they are still going to ring fence the funding for us.
Okay, thank you, Sam, and thank you everyone for contributing questions, and thank you to our speakers, particularly to Maya and Ellie, for joining us today. As I said, we will share the slides. Please do reach out to us. The NIHR Academy are also really responsive to questions. So if after you've watched the webinar on Monday, you have questions, do always also reach out to the NIHR Academy. They are very responsive if you've got queries about, am I eligible and can I check this with you? So it's now 2:00. So I'd like to say thank you very much, everybody, to joining us. We look forward to hearing from individuals who are interested in pursuing a PCAF funding application with us. So thank you very much, everybody, and thank you to all our speakers as well.